repeal Obamacare, what do you replace it with? What's the replacement?
That's a great question. So look, my plan, you go online, it's got 16 components. I won't go through every one of them, but 3 simple things. Look, Obamacare is a mess for many reasons. It raises costs instead of reducing costs like he promises. You don't really get to keep your doctor and your health plan. It is less freedom and more dependence on the government, and we're creating a new entitlement program when we can't afford the ones we've got. So you need to repeal all of it. Not Obamacare light, not keep part of it, get rid of all of it. All the taxes, all the spending, the whole thing. Replace it with, my plan does 3 things. 1, it actually does reduce costs, my plan. It does that by giving a standard tax deduction so you can buy your health care through your employer or on your own. It does interstate, it allows the interstate purchase of insurance to allow more competition. It allows voluntary purchasing pools. It allows expanded access to health savings and wellness accounts. And it does other reforms. Independent analysis have shown that would reduce the premiums on average for families by $5,000. The second thing it does, it helps those that are truly needy and vulnerable. Those with pre-existing conditions, those that can't afford their health care. We give $10 billion a year to the states to do things like high-risk pools, reinsurance programs. We don't need a one-size-fits-all program from DC, but we do need to help people that have trouble affording their health care. Third and finally, and this is the most important thing, you heard in that very generous introduction, my background is in healthcare. That's what I've done in my career. The most important question you've got to answer in healthcare is, who do you trust? Patients and their providers, or the bureaucrats? I put the patients and their providers back in control. When I was the head of the Medicare Commission, the ED of the Medicare Commission, the head of the Mayo Clinic told us they counted 130,000 pages of rules and regulations in the Medicare program. Now the left came back and said, oh, it's not that bad, but it was still tens of thousands, even according to their number. Regardless of the number, what that shows is we've got too much bureaucracy in the healthcare system. I'll tell you just real quickly, at its best, I like quoting Churchill. He said, democracy is the worst form of government, except for all the alternatives. Same thing is true about America's healthcare system. It's got a lot of problems, but it's still the best system in the world. There's a reason folks that can afford it want to come here. And when you're sick, I bet you there's never one time you thought, boy, if I had the money, I'd go somewhere else. When my little boy, our second child, not the one that was born at home, when my little boy was less than 3 months old, he needed open heart surgery. Now we're blessed. He's doing great. He's 11 years old. He starts school tomorrow. I know he's dreading that, but that's okay. He's a normal 11-year-old boy. We were blessed. We had great doctors here. We had a great hospital. There wasn't one time I ever wished, boy, I wish I could trade places with somebody else and go to another country to get his operation. At its best, we've got the best healthcare system in the world. What I really worry about Obamacare is over time, it will erode that quality and innovation. We're already seeing many doctors leave the Medicare program because of the cuts and the bureaucracy and the hassle of dealing with the government. You hear a lot of doctors saying they wouldn't tell their kids to join the healthcare profession because of all the headaches and the paperwork and the bureaucracy. So my plan, and again, you go online to see the details, 3 things: controls costs, lowers costs, helps those that are truly vulnerable, and third, puts doctors and their patients back in charge, not the bureaucrats. Yes, sir.